In 1976, Cicely Saunders was invited to be guest editor on this edition of this American journal, Patient Care, and wrote a very well-received piece about the hospice movement. But she was concerned to clarify a few issues she thought may not have been properly understood by her readership, and the following year sent this letter to the editor with this, what I think is a wonderful list summarising what she considered was the essence of a hospice. St Christopher's had been running for 10 years at this point, so she really knew what she was about. And I'm going to read this to you. We believe that the essential components are concern for the patient and family as the unit of care, management by an experienced clinical team, expert control of the common symptoms of terminal cancer, especially pain in all its aspects, skilled and experienced nursing, an interprofessional team, a home care programme, bereavement follow-up, methodical recording and analysis, teaching in all aspects of terminal care, imaginative use of the architecture available, a mixed group of patients, an approachable central administration, readiness to accept the cost of commitment and to search for meaning. She had an extraordinary ability to summarise information, and she really knew how to use a list to incredibly effective ends. It's very interesting also in this letter, she refers to the research her colleague Robert Twycross had been doing in pain relief and medication. 1977 was the year that really saw the end of the use of the famous Brompton cocktail. This was a mixture originally of cocaine, heroin and alcohol used for pain relief. And it was supplanted because it wasn't always perfect. But when it worked at its very best, it made patients pain-free and lucid. And that was really important, that they stayed present so it could be with their families. So I think this is a really interesting marker of where the hospice movement and Cicely's thinking, exactly where they were in the late 1970s.